Hello, everyone, and welcome to another Insights from Women Leaders event. My name is Rola Kaakeh, and I'm the CEO of Salus Vitae Group, and I will be the host for the event. Now, for those joining us again, welcome back. And for those that are new to the series, welcome. We're very happy to have you with us and join us in this conversation. Now, a little background on the Insights from Women Leaders series that we launched in October to highlight the journeys and contributions of various women leaders in healthcare. These industry leaders will share their insights on a range of topics impacting healthcare, our communities, and their role in shaping the future. We've already had 6 guest leaders so far. They've all provided valuable insights and discussed a lot of their perspectives on leadership and what has shaped that perspective. So I encourage everyone to check out the recordings of those previous leaders if you haven't already done so. They're all available on our website, salusvitaegroup.com. Now, over the course of an hour, we ask our guest leader a number of questions. I will start first, and then I will open it up to audience questions. So please submit any questions that you may have in the Q&A box. We encourage you both during and after the event to post your takeaways from the event in the Q&A box and on various social media platforms and tag us at Salus Vitae Group. We love hearing how you benefited from the various insights and experiences of our guest leaders. Now, the session will be recorded and available for replay after the event. I know several people that have actually gone back and listened to them multiple times. So I encourage you, if you feel like you've missed something, to listen to the replay also when it's available. Now, let's go ahead and get started. I am very, very pleased to welcome and introduce today Dr. Ashti Doobay-Persaud. She is a colleague of mine and actually an assistant professor of medicine in the departments of medicine and medical education, and is the co-director of the Center for Global Health Education at the Institute for Global Health in Northwestern University's Feinberg School of Medicine. She is the founder and director of the McGaw Global Health Clinical Scholars Program for graduate medical trainees, faculty director for the online Masters of Science in Global Health through the School of Professional Studies, and the Global Health Elective Director, and is one of the leaders in the Health and Society curriculum for the medical school. She earned her BA and MD at Tufts University School of Medicine and completed a residency in internal medicine at Yale New Haven Hospital. She's also an active member in the Consortium of Universities for Global Health, where she has held leadership positions in education subcommittees. Throughout her work, she has become an expert and leader in global health, particularly ethical practice and competency-based curriculum development, and is dedicated to teaching social medicine. Welcome, and thank you so much for taking the time to be with us today. Global health is definitely what connected us.
It's such a pleasure, Rola. I'm so glad that you're putting this together for everyone, and it's a real privilege to be invited. I hope that I provide some insights or some good takeaways for folks.
There's no doubt about it throughout our conversations over the years. So I'm definitely looking forward to this conversation as well. So what we're going to do, let's just jump right into the questions. We've had a number of questions, and we can follow the conversation as they go. And then we will look out for the questions from the audience towards the end. So the first question that we ask all of our guest leaders, especially since it just follows an extensive bio that has all your past and present experiences, did you expect to be where you are today? Just even listening to that as you hear it. And then what are your thoughts on that?
So that's a great question. So easy answer, no, not at all. A lot of what I do, so the sort of programs you listed, so a lot of what I have done in my space and time has been programmatic work. Everything that I am a leader of up to the point of the center, I've created. So the way that I have led has been by creating something that I think I had a responsibility to create, make it exist, and then have become a leader of that. 10 years ago, when I started my journey in global health, it wasn't called global health. It didn't have a space. I would say if you asked me or not 10, 15 years ago, if you asked me like 5 years ago, 6 years ago, as a junior faculty member who was teaching global health, sort of doing a lot of volunteer work, making programs happen, I would say, boy, it would be really nice, but there's no such thing as global health education. It's not its own space or field or practice or study. In fact, no one even really recognized global health as a space, until 2008 or 2009, after I started practicing. So no, because like nothing ever existed. So there wasn't Masters of Science in Global Health. There wasn't a scholarly program in global health. There wasn't intentional pedagogy around the electives. And asking me today, it's sort of my dream job. So people have asked like, oh, what would you, 5 years ago, what would you want to do with your time? I'm like, oh, well, I'd love to spend all my time doing global health education, but that's not possible because and this is what I said, no one would actually pay me to do that, right? I was like, this is my hobby or my passion. But it's not something that has a structure, a space, of a clear value, or something that's accepted. And so we've always, in our little field of global health educators and global health, we've always sort of struggled, right? We struggle to define our space, struggle to define our value. So it's actually, my dream job to get to think about global health education or global health or equity, disparities, social justice, and how to teach and learn, for the majority of my time.
And what's so great about that point is that although you didn't expect to be here, the expectation was in that there wasn't a specific position that you were looking at or a specific item that already existed. And there's a lot of power in that distinction because oftentimes people, what they expect is that it already exists, that they have to walk right into it, or else they can't do it. And so therefore that's not their space. Whereas as you progress, you create those spaces. And starting with that is so wonderful because a leader truly is one that paves the way, either for themselves or for others. So that is a wonderful way
to get started. I mean, I think that's a really neat point. I think that it has been, it's both helpful. It's helpful for me because I get a lot of bandwidth in terms of decision making, priority setting, goal setting, because I'm making much of it up that aligns with what our institute wants and the institution wants. But it can be also a little confusing because you don't have key performance indicators that you need to meet, or you don't necessarily have the metrics and the language that everyone understands to show your value, because it's all sort of created and new. But definitely it's one way to do it for sure.
Yeah.
And you get street cred doing it that way, which I think is a big thing. So this idea of different kinds of power and respect and deference, people know that you've been working in the space.
Yeah. And people know because it's kind of an empty canvas or a blank piece of paper, and that you're paving the way for that, or you're defining those, which we know is so incredibly hard. You now see definitions of things that might be 1 or 2 sentences long, and you think, oh, that's very simple, but it could have taken a very long time to get to those 1 or 2 sentences. So people really, truly respect that. They respect kind of that uphill climb that when you do create something, although it is very tiresome, there's a lot of uncertainty with regards to, is this the right approach? We've tested other items, this isn't tested. So yeah, I have a lot of respect for people also that create from new, no matter how big or small. So on that, also a topic of creation, and when you think about your future, so we've just briefly touched on some of the stuff that you've done, but when you look at your future and what you hope to create and what you want your legacy to be, what does that look like? What's in your future?
Yeah, it's a sort of interesting, it was a good question. It really pushed me here a little when you asked me to think about my future. It's not something I do naturally. I think very much in this present moment and what needs to be changed or adapted right now. this is, about to say something really cheesy, which is sort of like my future is sort of this now moment of defining what a Center for Global Health Education does. Like, what is our role? Who are we going to serve? So now I feel like for the first time, I've defined the field in different ways, in different spaces in writing, but like defining something organizationally, like that is my future right now. So sort of legitimizing the space, being like, this is a field, this is a space. These are all the different ways we do it. This is how we can do it. I feel like this is the next, and maybe it's just the way I work, but that's like the next emptier, place that, or like amorphous space that needs time and energy to think about how to do it well. And maybe like, again, how to organize it, right? So how do you organize it in an academic institution? What does global health education mean? And sort of who are our stakeholders? Who do we serve? And there are two sort of big goals, and the legacy would be that global health. So I'm going to try not to be too like specific in my topic, but the definition of global health is important here in that it is interdisciplinary. It crosses across all fields. It's just like health, right? So it involves all sectors. And traditionally, global health has lived in like really clear silos, particularly in the medical space. And so our center is one of the few that crosses the campuses. So we have both the medical school and the graduate school and the undergrad campus, the Chicago campus and the Evanston campus together under one roof. And so what I hope is to create that as part of the education, that it really is this like underpinning. There is a clear foundation that like all is needed. There's a big pipeline of learners. There's a big pipeline of knowledge, but this like the connection, and the notion of all disciplines and that all is needed and that we need to think in like a big system and not in like the individual care, which is critical in our health space. But the global context is really important. And all of our, we've got our colleagues in anthropology, nutrition, water safety, engineering, just like all of this sort of talent and knowledge. And I just think it's important. It's easy for me to look for my learners because that's just like real small focus. So like what my learners, my medical students, my residents can get from being exposed to a different way of thinking, a bigger way of thinking is enormous, and then vice versa. And so I guess the legacy would be a genuine connection, where it's like, I don't have to describe it in a million words because it's part of the culture and it's part of the space. The how to get there, I'm working on, especially in this virtual environment. But that would be one of the things that I would like to exist after I'm gone. And then I would say the second one is very academic in nature. And this what do I want? My concrete goal here is to make global health education a place of study and research that has like a clear academic space. So that really means just using science to define your best practices and your methods. And that's what you do in in academics. And I've thought about, starting a journal of global health education, sort of like what are those ways to do it? But the idea being that just like how it wasn't a field 10 years ago, it's a field, or 20 years ago. Oh my God, 2009. I started doing work then when I was a medical student. It wasn't a field, and now it's field. Global health education didn't exist. Now it exists. Academic global health didn't exist. Now it exists, so this sort of, and like an interdisciplinary understanding of global health didn't exist. Now it does. That's sort of like we're trying to get everybody to recognize where the field is as defined by like the experts or those who study it closely, and want to teach it well.
Well, to your actual point about working in the now and focusing on the now to kind of create a future legacy, and you actually, so 10 years ago, or when you started working in this space, did you still have that visionary outlook where I think this is going to be big, I think this is going to be common practice later? Right now, even within the last year, even since we met a few years ago, I mean, the interest in global health has far exceeded several people's expectations. The pandemic has brought to light the need to understand global health. But is that something where you deep down inside said, I know this is going to be something big and I want to be part of that narrative? And that's how you continue to design, like you do the work now, but do you have that visionary type of like, this is going to be so big?
No, I am all about the responsibility to create what's needed. So I think the best way to describe it, and my residents are like really tired of hearing this, you need to hear the story, right? That's the other thing I teach in stories. So the story is that
yes, please.
When I was a medical student, I like picked up a pamphlet off the wall of the student office that said, go to the Himalayas and do some global health work. And there was, no space. It was literally a brochure. And I asked like somebody in the office, I said, does anybody know who like put this up there? And they're like, no, we don't know anything about it. And I was like, okay. So, I took the brochure and I started reading about, this Himalayan health mission. And then I joined for, 4 or 5 years. I did clinical service. And then I chose my residency program. Actually, I knew when I was like 7 that I was going to be a doctor. I wanted to be sort of very cliche, but it's true. Like Doctors Without Borders, I knew I wanted to serve. It was like very clear. So that my motivation and passion is very much in that space. So I knew that. And then I chose my then I did this work and then I was like, I don't know, there's some things about this that don't totally feel like it's the right thing that I'm doing, but the mission fulfills what I want. And so then I looked for a residency program that had some kind of global health. Now I think every residency program has something in global health. But I went and I chose one of the 3 residency programs that had global health that was somewhere I wanted to go. And so then I chose my residency based on that. Yale had an exchange program. I did that. I learned a lot. I did a lot of work. It was right at the rollout of antiretrovirals. So it was real, the way people like picture global health to be. I was like in a clinic seeing patients with HIV and caring for them, and AIDS for many of them. And I didn't know anything about global health. Like, I didn't know much socially, politically about those countries. I didn't know about their history. I didn't know the major players. I didn't really know who PEPFAR was. But I had the agency to go and serve. And I said, okay, this is a problem. I love to learn things, but I love to have like the facts and the history. I'm really into that input. And so I was like, there need to be programs. Like you have no business going to do this work if you don't know how the space works, how the world works, what the challenges are in global health, what to be looking for, what's a good program. And of course, ethics became then a very deep space. So I basically created all the programs I wish I had had. So everyone is like, oh, you want to do global health or international health, it was called then? They're like, get an MPH. I was like, I don't want an MPH. I want an MSGH, which is a program I created now. When I was a resident, I was like, I really love working here in Tugela Ferry and I'm learning but I'm learning like I should have been more prepared. I should know what to look for. Like this learning is imbalanced. There are a lot of ethical issues here. So in order to like really practice best, really like the best ethical practice required preparation from high-income learners, high-income faculty. And then I created an exchange program because there were like a paucity of faculty at a clinic I was working with. So everything I've created hasn't been for like futuristic vision. It's actually like, just for the listeners, not the best leadership modus to always be problem solving, but it's like maybe okay because it's problem solving a macro problem, right? Like this, like big, there's like there's a problem with practice. There's like a problem with service delivery. There's a problem with volunteerism. There's a problem with unprepared learners. There's a problem with people not understanding global health. And that needed to be solved at all the levels that I had the privilege of moving through. So different, I think.
Yeah, no, I like it. And that actually gets me to with the next question about the skills needed. So you've identified some themes that I've been able to extract from the conversation in terms of self-identifying what you do and do not know and what you still need to learn in order to go back into those spaces or understand the context that you're in. And right now you mentioned several other problems that if you're in problem thinking mode, that you're like, I need to address these or go into that. But what skills or what tools would you recommend people start to build? You know, like what do they need as they move along to either self-identify, to help create? What provides them with a good
Yeah, there are a couple of things, and you'll hear me. You kind of picked up on it really nicely. That idea that I keep self-identifying what I'm good at and what I'm not good at, and that's because that's sort of like the number one leadership advice is that you really, really need to know your strengths. And I'm going to say this, and I really, really mean it. You do not have to be good at everything. There is no way you're going to be able to be great at everything. There's just not enough of you. But as a leader, you need to know who you need and how your team needs to be everything, right? Like you need to be able to support everything in some way. So you need to like really know yourself, know what you're good at, leverage that, and try to think in an asset mode. So like not all great leaders are futuristic, right? Not all great leaders are visionaries. Not all great leaders are like loud and extroverted and charismatic. You know, it's like you have this picture of a leader, and I think that we need to disabuse ourselves of that more than anything, and really lean into what makes us strong and figure out how you can use that to, you know, find your influence, right? To like figure out how to get things done, to make people believe, behave in a certain way because you know, that's the vision that you have either co-created or that you believe in. So I've got two pieces of advice for you, but like one big tool or something that I keep saying to myself is once you take the time to identify your strengths, and like I said, like, you know, a strengths finder tool or whatever, there are all these different tools. They matter. It matters more that the moment that you identify something about yourself, not the actual tool, not even the accuracy of the tool, but more of this idea, like I will figure out who I am so that I can know how I need my like space to be and who I need to make this work. So the idea here is you recontextualize your weaknesses. You know what your weaknesses are. It's good to identify them. Take those weaknesses and don't call them that. Call them, these are the strengths that I need on my team. You do that, you know, it's all about frame of mind. And
Yes.
That's sort of the global health joke. Like sometimes I literally have said, all I teach people to be is a little more humble, have a little perspective. And here's a joke, I'm Canadian, is to be more Canadian. That's like the joke that I'm like, oh, I've created this whole space. I just teach people to be more Canadian. But it's really like, it's a frame of mind, right? It's this like, so reframing your native abilities, I think is like a concrete thing you can do that will really help.
Yeah. And I keep hearing, which is actually so wonderful in terms of the goal is the accomplishment, the action, what is it that you're doing towards, and your point to identifying what is it that you need in order to accomplish. Do you need to be that visionary? Do you need to be that problem solver? Do you need, and then recognizing all these tools that you need to accomplish. I mean, the goal is the accomplishment, not that you need to become a visionary leader or that you need to become this type of leader. And framing it that way is so powerful, because then it helps you think, okay, well, maybe I'm not a visionary leader, or maybe I am a problem. And that is okay. Because in the end, me and that visionary leader or that visionary and the problems are accomplishing something, which is ultimately what it is, what you want to do. So that is a wonderful way to frame it. And I think it's something that I'm going to continue to think about too, because we do often think about our own strengths, maybe what our weaknesses are, thinking about it from who do we need to put on our team in order to ensure that things happen. And I love that, you know.
And being transparent about it, right?
Yeah.
Maybe like not too much. I think sometimes I can be a little too transparent, but it's okay. I think that is also, so one of my overall, like this whole, I've been doing like all my leadership work turns out to be all introspection. That's why I'm in a real introspective, you've caught me in a real self-reflective moment. But that's like what leadership work turns out to be, is knowing yourself, because if you can know that, then you can know how to do the relationships after that.
Yeah. Understand yourself, and that'll also help you understand others. That's true. Because you also realize too, you need to be light on yourself. You need to offer yourself time to
self-compassion.
And to be, yes, compassion, right? And be humble and recognize. And when you do that for yourself, you will do that naturally for others, because it's an instinct that you spend the most time with yourself. So I think that's such a great way to think about it. So that's actually also a good transition to our next question that talks about success, right? Do you have a specific definition for success, or how do you define success to say, yep, I've been successful in that, or I have a successful career? How do you begin to think about it?
Sure. Well, I think I sort of started a little bit kind of talking about it, but this idea that the Center for Global Health Education, or that global health education, is a recognized field that you could potentially, I don't have the kind of markers. I think my co-director does. And I think this is one of those, for me, success is that my learners are learning. But the bigger vision of success is that this is a space, this is a field, this is recognized, respected, it's legitimate. My vision for success is incredibly intangible. It's the frame of mind shift that everyone would have about global health, right? This like notion that it isn't traveling to another country and like doing service, but this like global space. So it will be a cultural change, and it's happening. But that there's intentional teaching and training and partnerships, that, that there is learning that needs to happen and care that needs to be taken in partnership building, in international work, and that there's training that's involved. So like, it's sort of just legitimizing my space. It would be sort of step one, or success one. And then success two is that all these learners would kind of be together and like learn from each other and have a community. And then that our educators would have a community, and that we'd continue to grow and innovate. And, the idea of, I guess you could say like number of students, number of recruitment, that's what the measurements are for the institution, right? But again, everything it's much more macro than that, or like number of programs, number of faculty that join, that's how you call success, or PhDs, or you have fellows. A lot of people in the academic space will say the biomarker for success of a program is like having a fellow, because you've like managed to create such a competitive, but that's not the space I live in, right? So to me, We have we have a small fellowship. It's a research fellowship. You have HBN, you have, Fogarty fellows. So again, intangible sort of philosophical understanding of global health, ethics, quality and practice. All of my work is based around ethical practice. All of my teaching is really focused and centered, founded on ethical practice. And so that would be a standard for all programs. And I guess that everyone would buy into that.
So the distinction I also kind of made, I was thinking as you were saying, your success definition is a visionary one. It tied, as you were saying it. So the future one, legacy one, you were these are the actions. This is what I need to do. This is what I need to accomplish. Very action mode, right? Because you're like, this is it's dependent on me. Whereas your success very much embodies everybody else, which I think also plays a lot with a lot of the themes that our leaders have been saying, is that success, how you define it, could be your own personal success, but for the most part, it's generally seeing others succeed so that the overall mission is successful, or overall theme. So as you're talking about your learners, or those that you're building in terms of faculty and program development, or anything across what you're doing, then success became like my success, or how I measure success is when others are also successful. And that's so great. I quickly made that distinction. It went from action, your own individual action, which is so instrumental, to then that ultimately does translate into something that's visionary, wherever you end up defining it. But where it's visionary is that it also helps build other people. That's my interpretation of it.
I love that. I love that. And I wonder then if, because I'm doing introspection as we're having this conversation, because you're giving me feedback. I wonder because everything I've done has not existed before. So that's probably why you picked up on this like visionary notion, right? I don't think of myself that way at all. But I wonder if it would be different if I were passionate about something that already existed and needed improvement. I don't know. Do you know what I mean? Like the things I want to do. And it turns out that all the things I want to do all don't exist. So like that's global health, but then I do stuff in the medical school, and it's like sort of social medicine, right? And so again, it's like a space that not that much exists. I have colleagues that are doing a lot of work in it, but like I have all this room to move. So I haven't had any other challenges that have been like straightforward. So I don't even know what it would look like, and maybe it's just the words. I should have just given you.
No, it's perfect. Actually, no, I actually really like it. I was saying it out of admiration, in the sense that what you can control, and your initial mindset was, when you're saying my legacy or my future, you went into action mode, whereas success, you defined it more broad, and then in that opinion, you focused on somebody more than yourself in order for that. So it's not that there's a right or wrong answer, but I was just making that connection between the action mode versus visionary. And some people start the other way, right? They want their story to be part of that large narrative, and then the action mode comes later. So it's just sometimes a matter of how it is you place it, where you think about it, but the general themes of lifting others in order to be successful has been pretty consistent. So the next question pertains to everything that you're interested in. You touched on different things, and you are only one person. So how do you prioritize? What do you pick? Like, if you have 20 different things that you're interested in and how are you beginning to even prioritize what you do?
Okay, that's a hard skill set that I do not have. So what do I do? Let me give you some tips on this, because I've been thinking about this a lot. So I have a lot of ideas. I'm a person that has a lot of ideas. Not all of them can be done. What I do have is I bring a lot of this to a really small leadership team. And I try to figure out, because you don't live in a vacuum. So I have to do things that align institutionally. And I wonder if I've not quite thought about the pie chart of this, but everything like that I'm going to describe has one thread running through it, which is like, it has to be based on my values and passion, right? Like that is where we're going. But I have to align with the institution. So I have to deliver what my institution wants. So that has to be a priority. There's like, the bills have to be paid. Number 2 bucket, I would say, is I'll take a priority, and I'm not as organized about this as I'm saying, but I try to collect a lot of information from my stakeholders and see what people need, and then try to prioritize something that really goes to the people that we serve at the center. So I'll have to choose something from that bucket, and then always choose something that improves the lives of my learners in some way. And then 4th, I guess this is the real thing. Always my passion projects. So whatever big idea I'm most excited about, has to be part of it, because, so much of doing this work, and especially doing all this kind of work, is you get great joy out of it, right? You're happy. If you're not doing work that you're happy with, it's not really worth it. I mean, you get to be privileged to do that, but it just, you don't have the energy and the drive. So I'm moving into another new space, and I don't know how it's going to fit into everything I do. But most of my career has been focusing on people like me as they've moved through the medical and global health industrial complex, I guess, system. So people like me, so medical students, residents, someone who wants to get an MPH, but they don't want an MPH because they want to learn about global health. They want graduate learning global health, so an MSGH. So that's focusing on people like me. And basically, if I had that at every step of my career, I would know, 10 times more than I do now and be ready to go. So now I am doing work. I'm really excited about it.
I'm excited to hear it now.
I know, I'm really setting it up. I'm working with international partners to develop educational programs. And so all of the educational innovation at Northwestern and all of their educational innovation, we're going to share and crosstalk. So awesome. I just had the best training ever. November 12th to 14th, we launched a palliative care training program in Nigeria. My program lead is Nigerian. We recruited people from doing all the best work across Nigeria. So it's all Nigerian crosstalk. Yeah. We had our palliative care specialists at Northwestern who developed a program. Teach and talk, everything was translated for context. There was a Nigerian partner on every single, in every single lecture panel. We hosted everything on their websites. It was funded through a donor grant that I applied for at the Institute. And so my hand was there in organizing and bringing people together and thinking context, this needs to be place-based, this needs to be hyper-local, this needs to be owned. And I'm happy to say that so I think my colleagues would be fine if I talked about it. Essentially, there's no formal palliative care training or no formal palliative care programming at Lagos University Teaching Hospital. Lagos is a very, very large city in Nigeria with a lot of people. It's a hub, and it's the biggest city in Nigeria. And so to have no public palliative care programming is an enormous problem. They have it in Ibadan, which is in a different place. It's another academic institution. They have it in Enugu, another place, which is a different institution. They all look different. They just built a cancer center at Lagos University Teaching Hospital. And during the course of our programming, our attendees loved it. I mean, we had an evaluation work. We did really nice instructional design. We brought all of our educational tools we could. The leadership at Luth agreed to start a palliative care department as a result of this work. So we have 2 more trainings, and in our 3rd training, we're going to work on systems building and building a palliative care department.
That's so
with
great.
our colleagues.
I'm just excited for you guys too, as I think about it, how much you guys will learn in this whole initiative, right? Like oftentimes we think like, oh, this is where we're going to contribute. But the exciting part of it is that this is such a wonderful learning experience that you can also hope to then translate to other areas. And yesterday we talked to Catherine, who's part of another webinar series, and she was talking about how they have this adopt and adapt approach, right? Where you adopt something and then you quickly kind of adapt it to the needs of that area. And so there's so much opportunity in starting, like it's one program that grows into others. And then you kind of have this framework of adopt and adapt, like Catherine had mentioned, which is very, very exciting.
Yeah, one of my colleagues actually said, hey, do you think you guys would do this as like a consultancy, like where you go around and you help? And I was like, let's just build this belly button. But we are
action mode. That's actually an action mode. We're in action mode right now. So talk about it later. We'll talk about that
after we have a department. After, can you imagine we're like, and that's the thing. That's the other thing maybe about leadership.
Yeah.
There are two little pearls I wanted to give you.
Please, yes. Talk about that.
Just let people know. Two things is that you have to, this maybe aligns with your vision, you have to have a kind of ridiculous optimism and positivity, right? Like, I never met any of these people. I don't know any of these people in Ibadan and in Nugu and all these places. We'd never done anything. And we were like, I was like, okay, well, we were going to do it in person. I was like, okay, well, now I have to do it online. These are the dates. Let's do it. And so this like just having an idea and leading with optimism. So one of my really good friends, especially in the social justice workspace, everything is hard and bad and unfair. And I hate that in the world, but it's true. And so if you're going to work in a space where you're tackling that all the time, you have to be the one that's, no matter how bad it is. I mean, this has to align with your personality. People are going to think you're crazy if you're not a person who like does that naturally, but leading with optimism is huge. It really changes the way that everything can happen. It's that idea of a frame, right? Like, that's a huge piece. And then the second big piece, and another thing, and the reason I bring these two like pieces to you all is because they're things I'm working on, is that you don't have to have all the answers. So this idea of like coming to meetings or calling meetings or bringing people together and having no solutions yourself, maybe some, but going in with questions and knowing that you're going to come out hopefully with solutions. But you don't have to solve everything. You need to define the problem you're trying to solve. That's your job. And if it's like a clear answer, you're not going to ask them like ridiculous questions. You know what I mean? Like if they're really obvious solutions to things, then propose them. You don't want to waste people's time. But being okay with not knowing or not having to come with all the answers. That's another one of those, I feel like, leadership myths, Yeah,
and I love that when you talked about optimism and coming in very positive, it's not that you don't think that things will go wrong, right? You anticipate those, but being in that mindset, which I think is also one of the themes that you've touched on a lot in terms of getting that correct mindset and identifying and reflecting on what you do and do not know. And there is actually a lot of power in saying, I do not know, or I need to learn more, right? People respect you more. I think there was this thing that I was reading where people were talking about if you've worked with someone for a long time and they've never said, I don't know, or I need to look into that, or I need to, they haven't done enough self-reflecting. But, there is a lot of power in that in terms of building a trusting relationship with people, right? That human element of saying, I don't know this, but I'm going to work to recognize this or to learn this. And I'm sure in the global health space, that is extremely important, right? Especially when you're going into an environment. As much as you do your homework, you've not been in that environment yet. So that ability to learn is so important.
Yeah, I agree. And like, even as you're saying it, I'm thinking you just teach that, right? Like we teach that curiosity or that learning, and that's part of it. And we teach it intentionally in global health, and we teach it intentionally as you're saying that, I'm like, oh yeah, we do this. We teach that pretty intentionally in like our community health spaces too. This notion of like intersectionality or, whatever it may be, but that is part of, you got to get that reflection, right? And you're right. Like if someone says they don't know, gosh, it's hard to trust them,
And it brings back to your initial point about when you're saying that you teach people to be kind and humble, especially when you're in environments where people are smart, right? Like at Northwestern, the students are like, they can learn the facts. It's not going to be hard for them to learn specific things. But what people do need to be reminded of, what people do need to reflect on and understand is the ability to recognize what you know and don't know, and in order to build yourself. Because as amazing as a professor as you might be, even as I teach this, the facts might change in a week, month, 2, in a years down the road. So what is it that you're kind of thinking in that thought process? I do want to get around a question, the next question, about what are we getting wrong about leadership? Like, what have you heard over the years where you're just like, no, please don't be that kind of leader, or this doesn't make sense? Is there anything that stands out to you?
That's a good question. So I think some of the things that we've been getting wrong about leadership, we've maybe talked about a little bit, right? This idea, these couple of ideas about like, you don't have to be good at everything. Like, so I will just share that I did like that strengths finder, and I was like appalled that I had nothing in the executing category. I was like, how is it that I've made all these things happen when I don't have a single thing in executing, And it's like, well, it seems that I find people who are really good at arranging like a set of activities, and I'm lucky that I've relied on them. So that idea, like that's definitely what we've been getting wrong in defining leadership, or that myth. And I don't know that is like pervasively changed yet. Like, I think people still do think that I need to be a visionary and I need to be able to like cross every T and dot every I on a spreadsheet. And if you're expecting that of me, like I am not going to succeed. And so I think creating, like, people need to accept that, leaders and followers alike, right? That's that space. I think that's the other thing too is, and I don't say follower as much as like the people we serve, but the relationship between the leader and the people we serve has I feel like that has always been like a one-way arrow and needs to be bi-directional. So I actually just spent Monday or Tuesday, spend about half an hour reviewing if I had actually asked all of our stakeholders, if I had even identified all of our stakeholders before we started the center. And then I looked at, we'd done a survey. I think you did the survey, I don't know. And I looked at, sort of what people said they wanted. And there's been a pandemic in between. We've created some communities of practice, but is this everything everyone wants? I don't know. So like, I actually think getting back to the people you serve, maybe, I don't know that that's something that people don't do, but I think they like spend a lot of time, like, learning how to project manage or go to leadership seminars and try different things, communication styles, blah, blah. And like, maybe they just need to lean into the followers as it's called in the space. So I think we've been getting that. And I think, who does that kind of right is politicians, or not right, but they go to their constituents, right? They like to see what people really care about, what people really want. So especially when you're an academic institution where priorities come from the top very clearly, right? And, performance is measured by what our dean is looking for. And so, and our division chief and things like that. And so, taking the time to just quiet all of that down and look to the people you're serving, I think is something that we could get more right if we're not doing it already. And then this, I feel like a lot of leadership work has been done around just empathy and connecting and communicating and engaging. I think there's like now quite a lot written about that in the, the Daniel Goleman, kind of world. Those people who write about leadership, they will just talk a lot about how critical it is to be empathetic, to be vulnerable, to be compassionate. And one of the things, it's so cheesy, but relationships, that's it, right? Like relationships, when you said that, I just wrote down relationships. Like, I don't know that we're getting it wrong, but I think we still think of a leader as some sort of like icon at the top of this tree, but really it's this person in a web of lots of relationships, right? And then I guess maybe the last thing we need to get right in leadership, and I don't know the answer to this one, is communicating strategy and like information. Like, I don't know how to solve that one. Hopefully someone in your series can, but really figuring out how to manage the flow of information and strategy in an organization is still something I think a lot of people struggle with and leaders struggle with. I don't know how to do it in ours. So I guess to answer your question directly, what I think we're getting wrong is we're under prioritizing the flow of information. Some people will even call, I think somebody like even in one of the leadership seminars, like called an organization like a place where information flows or something like that, like one of these sort of more abstract definitions.
Yeah. And then you made the point about the flow of information being in both directions. Oftentimes people perceive like, I am just going to tell them, the one direction. So within that, in order for it to go both ways, listening is very much involved as part of that communication, which is, I was talking to another guest leader and we were talking about like, that's why women are such great leaders, because we really know how to listen. So I was like, that is true. She's like, women are very good at listening. And so, but I think generally that those are so wonderful with the general theme of communication, and that makes sure that you are, I always hear this thing and I say it all the time. It's like you have 2 ears and 1 mouth, so you should listen twice as much as you speak. But there's power in that to change how we lead, right? Because you will realize the more you read or listen to other people, your perspective expands in a way much more significantly than if you were just going to go and present on it yourself, right? Mm-hmm. And so even though you're doing that, the research or whatever to go to that, so the power in being able to listen and understand, and I think that's a major driver in your practice in global health in general, is for it to be successful. You do truly have to understand the context and listen to that. So we do only have a few more minutes, and I do want to make sure to get this question in that we ask all of our guest leaders, because we would like to take this opportunity to support one another and recognize the positive influence we have on one another. Can you name a woman who has inspired you, and why did you choose this woman?
Okay, sure. So Karen Sheehan is the person I'm going to name. I don't know if you know her. She is a professor of pediatrics at Lurie Children's Hospital. She heads up much of the healthy communities work. So all of her work has been really around improving the lives of children in Chicago through like place-based interventions. The work I do with her is in the medical school. So I work in the health and society curriculum with her. But why I chose her is because of the way she makes me feel as a follower. So she leads in a quiet way. She does a lot of work hands-on. She trusts me, and she like makes me feel really confident in my decision making. And she shows a ton of compassion to everyone all the time. She expects things from everyone, manages everything, but the compassion and grace with which she works, you want to model her. Like I know I can't because we're very different, but maybe I can I've taken elements of her compassion. And it really comes down to this idea of like intentions and actions. Like, I think she sees the world in all good intentions and sees actions as they are. Maybe, I don't know, but it's, and there are, you know, of course I'm going to quote some data, but there are data out there that like your most positive leader is someone that makes you feel trusted and like feels compassion. Like having her in my life makes me feel better. And she is a leader.
Yeah. And
she
actually, yeah.
Be so embarrassed if she knew that I said that. I'm gonna tell her, but yeah, she'll be like, she won't believe it. Sorry.
So there were points that you made though, which I think are so valuable as we look to people that inspired us, or even to mentors, to everybody, in terms of they don't need to look exactly like you with regards to what they're doing. You know, the details. We often look to someone exactly like we want to be exactly like this person, and that isn't necessarily the person that's going to inspire you, or that might serve you in all the ways that you want to in terms of your mentor. But you did say something that's very powerful about truly inspirational people don't spend the time telling you how inspirational they are, right? They make you feel that, which is exactly to your point, right? Like, it's how you feel when you're around this person, what you want to do, what you want to accomplish. Yes, you know that person is accomplished and they've done a lot, but it's how you come out of it saying, now I want to do that. That's where a true, I think, leader kind of has their impact. I'm sorry, I'm just adding to a lot of what you were saying in terms of these points. So we only do have a minute or so. Is there any closing remarks or final thoughts that you would like to add before we end this session?
I think that maybe there's one thing that I didn't touch on, which is just, you made me think really hard about how would you describe a leader?
Yes.
And I didn't really know how. And so I had to take a little time. I said, well, gosh, I just do it all the time, right? So shouldn't I know what I'm doing? And then I wanted to share what I worked on.
Please.
So I don't know. We'll see. It's a leader as a person who has a vision or a goal and can use their power to guide or direct their team to achieve that goal or vision. And it requires the reason I put power is you can unpack power, but it requires the leader to motivate, mobilize, and orient their group to the current context. But they have to do all those things. They have to motivate them, they have to make them move, and they have to show them the space. And I put power in quotation marks because the person I was just talking about, her power isn't rewards, coercion. I respect her. And I think that maybe that's what it is. It's this what is it? I can't remember the name of it, but it's like deference or respect. It's like you do, because what their power is they have the power that you want their respect, right? So I wanted to share that because it took me on quite a journey to think about it. I was like, oh man,
and
okay. I haven't written this down before. No one ever asked me this, kind of thing.
Yeah, it does touch on a lot of what you said though, in terms of action, but being very intentional, and then building your team so that in the end, what is it that your team feels? What are they inspired to do? And then how can you go towards your definition of success or their own as well. So these are all so wonderful. On behalf of Salus Vitae Group and myself, I would really like to thank you, Ashti, for joining us today and for sharing these experiences and your outlook and having this beautiful conversation. There are several items I know I want to go back to and listen as well. And then later today, actually, we have another Insights from Women Leaders event at 2 p.m. So if you would like to register for that event, it's at salusvitaegroup.com. And then we have a few more till the end of the year. Thanks again for joining us, and we would love to hear any of your takeaways. So we do encourage you to tag us at Salus Vitae Group if you are to post them so that we can see them. Thanks again, and we hope to see you at the next event.
Thank you so much.
Thank you.
Take good care, everybody. Bye.
Bye.